When an individual presents with leg swelling, the initial diagnosis often leans toward venous insufficiency, particularly if the individual has been exposed to prolonged periods of sitting or standing. Venous insufficiency typically manifests through symptoms such as swelling and the appearance of visible varicose veins. At its core, this condition is characterized by the malfunctioning of vein valves, which may become compromised due to a variety of factors. These include obesity, pregnancy, extended periods of immobility, and genetic factors that predispose an individual to such vein-related issues. Transitioning to epidemiological data, it is noted that venous insufficiency affects about 20% of individuals over the age of 65, with a higher prevalence in females. This gender disparity can largely be attributed to the effects of pregnancy and hormones such as estrogen and progesterone on the vein's elasticity. In terms of management strategies, engaging in weight loss and regular physical activity, coupled with avoiding long periods of inactivity, can alleviate symptoms. Compression therapy is frequently recommended as a first-line treatment to promote leg circulation, utilizing garments like compression stockings. Regular elevation of the legs above the level of the heart can provide relief and is encouraged several times throughout the day. Furthermore, heart failure emerges as the second most common cause of leg swelling, particularly affecting approximately 10% of individuals aged over 70. The mechanism behind this involves the heart's reduced efficacy in blood pumping, resulting in peripheral edema. Chronic kidney disease, which can prompt unilateral or bilateral leg swelling, stands as the third most common cause. With its global prevalence reaching about 10%, its impact is significant. Signs of kidney dysfunction include proteinuria, elevated blood creatinine levels, and muscle cramps due to electrolyte imbalances. Additionally, certain medications, like calcium channel blockers, steroids, and NSAIDs, are also implicated in causing leg swelling. Moreover, it's essential to consider obesity, a worldwide health concern affecting over 650 million people, which can exacerbate venous pressure in the legs. During pregnancy, particularly in the last trimester, physiological changes can lead to leg swelling as the growing uterus exerts pressure on the veins. When swelling is isolated to one leg, it's crucial to ascertain the cause. Unilateral swelling often stems from physical injury or trauma, leading to inflammation and edema. The RICE protocol, rest, ice, compression, and elevation, is the typical treatment pathway, along with pain management strategies, which may include analgesics or, in severe cases, surgical intervention. Infections such as cellulitis must also be considered. Bacteria invading through compromised skin can cause localized inflammation, warmth, pain, and systemic symptoms like fever. Antibiotics serve as the primary treatment for such infections. Lymphedema is another important condition to consider, with its hallmark non-pitting swelling and often a sensation of heaviness. This condition arises from blockages in the lymphatic system, which can be due to various reasons, including infections, cancer treatments, or radiation therapy. Unlike lymphedema, pitting edema, where the skin retains an indentation after being pressed, is associated with heart failure and deep vein thrombosis, DVT. Lastly, it's worth noting that chronic venous insufficiency, often following a history of DVT, can cause swelling in one leg due to localized factors or anatomical variations. DVT itself is a serious condition where blood clots form in the deep veins and is characterized by unilateral swelling, pain, and redness in the affected leg. The risk factors for DVT include prolonged immobility and recent surgery. Treatment typically involves anticoagulants to prevent clot growth and reduce the risk of further clot formation.